Welcome to Common Sense Wellness with Dr. Gary Martin, the show that helps you take control of your health with clarity, confidence, and practical wisdom. Dr. Gary Martin has spent decades in clinical practice and natural wellness research, discovering that the key to lifelong vitality lies in understanding the body's signals before they become symptoms. Each week, we will explore simple science-backed methods like mineral testing, facial scans, and lifestyle adjustments that help you restore balance from the inside out. You'll also hear from expert guests and real clients who have turned their health challenges into stories of transformation. No gimmicks, no fads, just common sense wellness that works. Now, here's your host, Dr. Gary Martin.
Welcome to Common Sense Wellness, another episode. I'm Dr. Gary Martin, and for over 50 years, I've helped people understand their health through testing, practical wellness strategies, and holistic approaches. On this show, we explore simple, actionable ways to restore balance, boost energy, and thrive. And today, I'm honored to be joined by Dr. Jason Shumard. I'm sorry, but I got Shumard in my head and I can't get it out. Shumard has dedicated his practice to helping people reverse type 2 diabetes through safe, natural, and root cause strategies. He's the founder of drshumard.com. That's SHUMARD.com, a platform built on the belief that true healing, not just symptom management, is possible for every patient. Welcome, Dr. Shumard.
Yeah, I appreciate it, Doc. Appreciate you having me here.
So you started with a degree in kinesiology, then you went on to chiropractic school, then postgraduate worked in functional endocrinology and clinical nutrition. What was pulling you deeper and deeper into understanding how the body actually works?
Yeah, I think it really started as a child. I had pretty severe asthma and allergies as a kid, in and out of hospitals, all these taking medications. I just didn't feel like that was the only model, right? And then I was I did a lot of high level athletics as well. And I just wanted to be in like this like health and wellness models, what always kind of resonated with me. And initially I thought, you know what, I'm going to go to school and be a physical therapist. I can work with athletes, I can do rehabilitation type stuff. And I'd gone through some physical therapy with a knee injury and some ankles and stuff like that as being an athlete. Thought it was pretty cool. Well, come to find out that it just wasn't my cup of tea, if you will. I didn't really enjoy it when I was going through my college years, and I decided another path. And fortunately, at that time, I went to school at San Diego State, and one of the classes was they're going to have a different type of a profession to come and speak every single week. So we had like a nurse, we had physicians, we had different types of clinicians, physical therapists, etc. Well, one of them was a chiropractor. I knew nothing about chiropractic. I knew nothing about the condition, the career. I'd never been to one before in my life. But when he was speaking, the philosophy of chiropractic, that the body has the ability to heal itself and there are natural components, it really resonated with me. And like that alone, I left the class and really started educating myself. So when I decided to go to chiropractic college, which was a very big shock to my family because they thought I was going to do something different. But I did it on a belief that I felt like this was a path that I should be going because of the philosophy. I had never been to a chiropractor. I'd never had a chiropractic adjustment, and I went to school. I was like the only one there with that type of story. Well, my first even month there, I knew this was the right place to be. I was around people that were really similar in my beliefs and everything. But during that first year of being in school, my mom was diagnosed with type 2 diabetes. And like many individuals, I thought this is a condition that can be managed, not a problem. Well, as we all know, as most diabetics, they continue to get worse over time, taking more medication. And there was a point when I thought there has to be another way. I was probably in year 2, year 3 at this time. There had to be a better way. Well, our school was very open to a lot of different types of options. And we had someone come speak about functional medicine at our school. And so I was introduced to functional medicine while I was going through chiropractic college. And I really started like kind of changing my philosophy a little more. Like there's another ways. So I started taking functional medicine courses while I was in school, eventually kept doing it after postgraduate. And, I opened my clinic in 2005 doing traditional chiropractic work. But when I became educated enough, I felt confident that I can start helping people. I took this information to my mom and dad, to see if they would be interested in start doing some work to reverse her diabetes. Well, it fell on deaf ears. She was not interested. My dad was not interested. Like, oh, it's gonna be too much work. We're not going to be doing this. Her doctor's saying she's doing fine. We're not going to be interested. So for many, many years, we had this conversation, arguments, yelling, screaming, crying. Like there was a lot of stuff that happened over those time. But during that time, I started introducing this type of work to our current patients. It's those who are dealing with health issues and diabetes. And we started reversing diabetes. Eventually, I went full blown, hired associate doctors to handle the chiropractic side, and went full blown to functional medicine. And now I'm at where I'm at. I feel like it chose me. I didn't choose it.
So when a new patient walks through your door, whether it's your virtual door, I guess it's only virtual now, at drshumard.com, what does their story usually look like? What have they already tried before finding you?
Yeah, I mean, most of them have already tried the medications that are common medications with diabetes. They've tried the different diets, the weight losses, things like that, even some of the GLP-1s, and they're just not seeing the results they're looking for. Some of them have tried other functional medicine or other types of clinics and didn't get the results either. And the main reason why is that a lot of times we just do a little more comprehensive analysis to really identify what's really going on in the body that is contributing to why they have diabetes in the first place. Many people believe that diabetes is a blood sugar issue. It is not a blood sugar issue. Diabetes, the symptom of diabetes is blood sugar, it's elevated, but diabetes is truly a cell disease. And, truly cell diseases develop into multiple diseases, autoimmune conditions, cancers, etc. But with diabetes, is no different. And if we can identify what mechanisms are driving their cell damage, we can start to really understand why they have this condition in the first place.
Interesting. So would you say that this is the biggest blind spot in how conventional medicine approaches type 2 diabetes, or
It is the
is there
major
more?
blind spot. And the reason is because in the traditional medical model, the treatments of choice are pharmaceuticals, injections, and surgeries, right? That's thank God there's a time and place for all that. We need these things when there's certain things that are going on in our body. But their treatment right now is using pharmaceuticals to lower sugars. And it does a pretty good job. We've seen people lower A1Cs, lower sugars and stuff, but over time, those sugars start rising again. And oftentimes people think, oh, it's because the medication is no longer working or my body's immune to the medication. It's not the case. It's that their cell disease is progressing and more damage is occurring, which is why they need additional medications. So the biggest blind spot is the belief pattern that if I just lower my sugars, everything's gonna be fine. And that is 100% further from the truth.
So after 20 years in practice, what's the most surprising pattern you keep seeing in diabetic patients?
Toxicities,
Something that keeps showing up that conventional testing tends to overlook.
toxicities, definitely. Heavy
Toxicities.
metals, molds, environmental toxins, these things are not being done in traditional model or even evaluated because there's no pharmaceuticals to address them, right? So, and unfortunately, we've had many of our patients take their toxin tests to their doctors, and the doctor's like, thank you for bringing this, but there's nothing I can do for you because they don't have any kind of mechanism to treat this. Now, the good news is in functional medicine, there's lots of things that can be done to help get these toxic burden into a healthier environment, taking the pressure off their cells, their organs and tissues, and so their body can start becoming more in a homeostasis and regulate its own sugars again like it used to.
All right. So you've seen patients go from being told their condition is permanent, I'm sure, to actually turning it around. What does that transformation look like from your side of the table?
Yeah, so the first step in this process is we obviously want to get an idea of what they've done, like a history, et cetera, to find out what medications they're taking, what paths have they done. Those are just valuable foundational information. The second thing we want to do is we want to take them through what we call our root cause analysis, right? It's deep dive testing. There are two tests we run. The first one is a blood test, right? And I always tell people I'm not running a traditional blood test like your doctor runs because ours is more advanced. And we kind of have a conversation. For example, when we look at the thyroid and the traditional medical model, they're going to run two markers, TSH and free T4, right? But we're going to run 10 markers. So we're just looking at things a more broad spectrum, if you will, on a blood test. But what's great about it is we use LabCorp and they're all over the country, easy to access. The second test that we run is the toxin test I just mentioned. So it's a full toxicity test evaluating for things like environmental toxins, heavy metals, and molds. It's a simple test. As you mentioned at the beginning, it's a urine test, right? The lab sends a test kit to their home. They urinate into a cup. Within about 3 to 4 weeks, we get the results back. Once we have this data, now we can truly identify what problems is this person having from the blood test and toxin test, so we can start to put together the customized solution. The good news is, at least from my perspective, and probably yours as well, is that this is all natural type work. We don't need pharmaceuticals or any kind of other medical intervention because we can use nutrition with nutraceuticals to really address these problems in different stages. So we'll have anywhere between 1 to 5 different steps that are involved of taking this person through a process. So then when we retest, we can see lower A1C, lower blood sugars, less medications, et cetera, as this person is getting healthier and healthier.
So what is there a percentage? Is there a percentage that you could quote of type 2 diabetes cases that you think are simply due to cell disease or toxicity, and those that are just something else? And what else would the other else be?
Well, all diabetes is cell disease, right? Because if you
Okay.
think about it, this is where to kind of go back through the physiological aspects of it. When we consume foods as human beings, that food goes into our digestive tract, which breaks down into glucose, right? That glucose is then released into the bloodstream, which then triggers a response by the pancreas to release insulin. So now insulin and glucose come together and they drag themselves over to a cell. Outside the cell, you're going to have a little receptor, right? This is an insulin receptor. So the insulin attaches to the receptor, which now opens the door of the cells to now allow the sugars to enter the cell, get into our mitochondria, which is our engines. It's no different than your car, right? You throw gas in the gas tank, the fuel line takes the gas to the engine. This is a similar situation in the human body. But what happens over time is as the cell becomes deficient and the ability for the insulin to attach to the receptor becomes deficient. The insulin receptor becomes broken. And if the insulin can't attach, the sugars never enter the cells. So when this happens with one cell, it's not an issue. But now when you have 5%, 10%, 15% of your cells becoming damaged like this, next thing you know, the sugars can't enter the cells. So where do they go? Back into the bloodstream, causing elevated sugars. Now, the medical model sees this and says, well, let's lower those sugars, never looking into why the cells are damaged in the first place. Why is that receptor being damaged? Well, one mechanism is that when you start to have these boosts of sugars, these spikes of sugars, the pancreas is going to spike insulin. Well, spiking insulin into your system is like throwing too much water on a plant. What happens to the plant? It wilts, it dies, right? Well, the same thing happens to your cells. When you have too much insulin, it causes the receptor to start to fade away as well. And now you develop this insulin resistance. So everything starts at the cells, but that's just one mechanism of too much insulin. Now let's bring in other things, like, for example, toxins. Well, what do these toxins do? They affect the receptor. They block the receptor from doing its job. They damage the cells from closing and opening those doors. Other things like inflammation can do the same thing. Chronic infection patterns can do the same thing. The organs that are involved in blood sugar regulation, the liver, the gut, the kidney, the adrenal glands, the thyroid, the brain, all these things can impact the cell doing its job and contribute to these problems. So it's kind of like, having 30 holes on your roof. Which one was the original one? Well, they're all bad. We got to fix them all. If we just go and fix one of them, you still have 29 different holes, right? We got to go and address every single one of them, which is why the testing is so key, because now we can identify every single problem we're dealing with, and now we can prioritize. This is the prioritization number one. This is prioritization number two. And as we do this over somewhere about 3 to 5 months, we start seeing the A1C dropping, the blood sugars dropping, the need for medication going away. So in our model, we tend to have somewhere between about an 85 to 95 reversal rate, where patients are off medications, they're getting normal or better A1Cs, normal or better blood sugars. But if you look at the stats from the medical model, and we'll just quote the most common study, which was done in 2019 through the Journal of Nutrition, and they evaluated, I'm probably estimating here a little higher, but I'll just give it's roughly between about 400 to 500,000 people. This is a study by Kaiser Permanente, one of the largest insurance and hospitals on the West Coast, right? East Coast, but that's on the West Coast. And so what they identified was what percentage of these individuals actually went into remission, which they call remission, we call reversal, by following the standard of care. Now, standard of care was defined as eating better, changing your diet, exercising, losing weight, and taking pharmaceuticals. Now, so that's considered standard of care, the traditional method, right? Which everyone thinks if that's to lower the sugars and everything. Now, it was very interesting what they found because after evaluating all these individuals, roughly 500,000 of them, the percentage of individuals that were able to reverse or go into remission was very staggering, right? And we'll just ask you, Dr. Gary, what do you think that percentage was if you were to guess?
Very, very, very poor.
Yeah, well, what number would you
Yeah,
give it? Just give it a guess.
5%.
5%. It's a really good number. I would have probably said like 10, maybe 15%. The reality was what they found was 0.23%.
Unbelievable. I'm
Less than
not
a quarter
surprised
of
at
a
all.
percent. Less than
Yeah,
a quarter of a percent. So what it shows is what we know about diabetes. Because when you focus on the symptom, the real cause progressively gets worse. And until we can
exactly.
focus on the cells and get the cells healthier, the person can't get better.
Yeah, for sure. So it sounds like you're interested as much of like in the blood work that you do on the level of insulin
Yeah.
as well
Yeah,
as
that's a huge one.
as well as you are the level of sugars.
Yep, we measure two things. We measure
So
C-peptide, which is going to identify how much insulin is being released by the pancreas, because this tells us two things. Number one, is the pancreas actually producing insulin, right? Because that could be a problem for the individual. And if it is, great. Now we know we've got a healthy pancreas, and the pancreas is not the problem we need to deal with. The second thing we look at is insulin levels. Your insulin levels, if you're getting this on a blood test, should be below a 4, for sure below a 6. Anything above a 6 is very, very high. But below a 4 is ideal that we really want to see. So if you get a blood test done and your sugars are normal, glucose, fasting glucose is normal, A1C is normal, but your insulin is above a 6 or above a 4, you're developing the cell disease, insulin resistance, and your risk of going to diabetes becomes higher.
got it. So at Biological Immunity Research Institute, which is the sponsor of this podcast, IRI.org for short, we use a test using the urine and saliva, which we call the BIA, Biological Immunity Analysis. It's actually a soil analysis that got applied to the human body using urine and saliva. Probably got to start back in the 1940s or whatever. I found out about it in 1975. I haven't found any better tool yet, foundational tool, to be able to tell me many things. One is you mentioned toxicity. It's a real simple test. Basically, it's the what we call the ammonia nitrogen is what we read that the test takes 10 minutes to do. Anybody can do it because it's actually a soil analysis that's applied to the human body. Urine and saliva is pretty simple, pretty easy for everybody to use and whatever. So our mission is basically to help patients understand what's happening inside their body, often before symptoms even become a crisis. I'm not sure that we have that in common, but given everything that you've seen with your diabetic patients, how do you feel about putting more of these kinds of tools directly in the patient's hands? And what kind of self testing do you currently implement with people? You mentioned the urine tests for toxicity. Are there any others that are more, self tests that people can use?
Yeah, I mean, you could. There's like, the common stool test, the urine test, like the Dutch for hormonal analysis, adrenal analysis. Those can be done as well. But the reality is, a lot of that information we can get from a blood test to identify if there's a problem going on that needs to be looked into. So we're also looking into costs associated because we're trying not to, I mean, there's a lot of tests that can be run, but they can get quite expensive. And so
Right.
typically for us, we start with these two tests, which is going to give us a lot of information of what's going on. And then in some of the other home tests we'll do is, I guess they're testing their own sugars, right, with a glucose monitor or constant glucose monitor. These are things that can be easily done at home as well. And then usually if we get to a point where we do a follow-up blood test, toxin test, if those things are looking good, but their sugars are still not where they needed to be, or they're still an A1C elevated, then we'll start looking at other things other markers, hormonal imbalances. I like to use the Dutch for that, or even like stool analysis that we can look for microbiome deficiencies, leaky gut scenarios like zonulin, or even looking at infection patterns, right? Bacterial or any other parasitic type stuff, yeast type things like that in the gut that could be contributing to this.
Okay. One of our biggest obstacles to success is patient compliance. How much of a problem is that for you, percentage wise? In
Well, it
that
used to be a big problem.
people just don't want to change.
Yeah, it used to be a big problem. And the reality, what I learned, a couple things. The first one is I actually use it as a pre-qualifier. I use it as a pre-qualifier, right? So we have a long conversation with our patients beforehand and say, listen, I'm not here to convince you. I don't want to force you to do anything, but this is going to require commitment on your part. It requires you to do these different steps. Now, even when we implemented that, we still had a poor compliance because what we were doing at the time was we were doing pay for service, right? So they were paying for services, they were using them, which made it easier for them to stop. Well, what I changed was then I went to programs. So then when I created programs, said, here's what you're going to need. Here's your supplements you're going to need. Here's your visits. Here's your follow-up testing. Everything's inclusive. Here's the cost of your program, and then we just figure out a way that they can pay it off through monthly or paid up front with everything. So now they're paying for the program. We went from a 50% completion to a 95% completion by adding a
Wow.
program in itself, because that alone commits that gives them they have that commitment. They're like, well, I'm already paying for this. It's already here. So I might as well finish it off and make sure I get the full results. And we have amazing coaches. We have functional medicine coaches that go to what's called the Functional Medicine Coaching Academy. I only hire from there. They're nationally board certified, phenomenal, educated, and they know what to do, and they really have a passion for what we do to help these patients. So when you combine the coaches with the testing, and as they start doing these protocols, what we find is somewhere between about 3 to 5 months in is where they really start seeing the transitional changes in the way they feel, the way they function, but more importantly, their blood sugars. And that keeps them motivated. So if we can get them to that 3 to 5 month mark, they're going to finish their program.
Wow, interesting. All right. One of the things that we talk about in this show is making truth your authority, not authority your truth.
Yeah.
In the world of diabetes care, where does that idea hit closest to home for you?
Well, I think the testing, right? Because that becomes the truth for them, right? Because they understand testing. And that's one of the reasons why we love to do the testing, because it resonates with something they've seen in the past. The difference is when we analyze our testing, we do it from a functional aspect, which you're probably familiar with. We're not looking at it from a disease process. So we're evaluating to see where their check engine lights are, right? Now there will be some disease mechanisms that show up as well with these types of patients, but they truly understand, like, hey, we have this testing, this data. So it's not what I believe, it's not my opinion, it's what the data is telling us what's going on with you. And now we have a blueprint to what's happening and what needs to be addressed. And when you have that, that becomes more both trust and authoritative, because they understand it's similar labs they use with their doctors. So it just builds that trust of what's really going on. And we're not using, fly-by-night labs, if you will.
Right. So you're not just a practitioner, you're also a speaker and a community volunteer. What's the single most important thing that you want people to understand about their health when you're talking to a general audience?
I think there's a couple things. The first thing is that people tend to believe that as they get older, they're supposed to get sick. I think they're supposed to break down. They're going to get unhealthy. That's what the medical model wants you to understand, because they want you to go to them and say, oh, I'm broken. Please help me. And they're going to give them a pharmaceutical to address that. The human body, every physiology book says as guidance, all the anatomy books say that our body was meant to live a certain amount of time. Our heart was meant to beat 250 years. And we see this in some of the Dead Sea Scrolls. People lived a long time, right? And they are able to do that. It's the environment that we put ourselves in, the alcohol, the smoking, the food, the pesticides that break our body down faster. So if we look at our body as like a 401k, that's all I'm going to say, as a 401k, if you're investing into your 401k, your IRAs now, because when you get to retirement, you want to live a comfortable life. And I get that. But what have you invested into your health? How much money, how much energy, effort have you invested into your health? Because that's going to pay the same dividends Who wants to get to retirement not to be able to enjoy it, not travel, but be at home on the couch because you're so sick and so have no energy and thinking, well, this is normal life. I'm getting older. The reality is a 95-year-old can heal as quickly as a 25 years old. You just have to make sure you put the right steps in place. I think that's a key component. People really understand that their life is not based upon their age. It's based upon function and what they're doing today to help out that. Now you can have more control than waiting for something to happen down in the future.
All right. So for other practitioners who want to move their practice toward true healing rather than just managing chronic disease, what's your advice?
I think the first thing is that a lot of practitioners, they want to help their patients feel better. And I get that. But oftentimes they're using supplements, nutraceuticals as a tool to reduce their symptoms. Well, in my personal opinion, it's no different than what the traditional medical doctor's doing. They're just using a pharmaceutical and not a supplement. So I think it's important to help the patient feel better, but also to let them know, listen, our goals are to fix the problems that are contributing to your symptoms. So we can do things to help them feel better, but please make sure you're evaluating the individual to find out what's going on underneath the surface and addressing that as well. Because what's going to happen eventually when you do that type of supplement for symptoms, that's going to run out and they're going to plateau and they're no longer going to trust you. But if you actually evaluate them and say, here's what's really going on, this is why you have the headaches, the high blood pressure, whatever it is going on in their body, your high cholesterol, you can then actually give them some recommendations for some things to help them with their symptoms, but fix those problems as well, because that's when they're going to really trust you and really stay with you for the rest of their life.
So with all your success, what remains your biggest challenge?
I think the biggest challenge is people have this dogmatic belief that medicine is the only answer and that it's the only option they have. And their doctors are telling them that, at least what the conditions that I work with, that it is not reversible, that you cannot fix diabetes, that you're going to be diabetic for the rest of your life. You have to be on medication to manage this. And they hear that so much. And then what do we see on TV? Jardiance, all these medications that are coming up, almost every single commercial, right, that's coming up. And I don't watch a lot of TV. I mainly watch my Padres because I'm a big Padre fan. But you'll see the commercials popping up there for these drugs. And they see this over and over and over and start to believe it's the only option. When the reality is, if you really think about this, at one time in your life, you were able to regulate your own blood sugars, eat the food you wanted to eat, do what you wanted to do, and there was no questions asked. So if your body was able to do that at one time, it can do it again. You just have to find the path to get back there. And that's where we really want to understand that you can get better. The research is very clear that you can reverse diabetes. Unfortunately, it cannot happen in the medical model. You do have to go outside that box. I'm not saying get rid of your doctors. I'm not saying get off your medications. What I'm saying is that should be part of your team. It's a triad. Your medical doctor controlling your pharmaceuticals, you as the individual that is doing the work, and your functional medicine practitioner who's giving you the underlying healing capacity. The three of us together can really make a big difference in that person's life.
So where can our audience go to learn more about you and your work?
Yeah, the easiest place is my website. You said it earlier, drshumard.com. So it's DRSHUM as in Mary, ARD.com. There's a lot of information about what we do, but more importantly, on that site, we have a registration page for my webinar. And my webinar is very educational. I go a lot more in depth about what we do, how we do it, and the outcomes that we expect to see as well. If there's anyone interested in learning more about insulin resistance, type 2 diabetes, I would strongly urge them to attend that webinar. You're going to get a ton of information. And of course, there's an option if you choose to schedule an appointment at the end of that. There's an option there for you to do that.
Okay. Well, thank you. Thank you for some incredible information. And I'm sure that thousands of people are going to benefit as a result. So thank you for taking the time to be on the podcast.
Yeah, thank you so much for having me, Doc. I appreciate it.
Thank you for joining us on Common Sense Wellness. Remember, taking practical steps to understand your health, emotionally and physically, is how we restore balance, boost energy, and thrive. See you next episode.
Thanks for listening to Common Sense Wellness with Dr. Gary Martin. To learn more about the testing and resources we discussed, or to find out how you can take charge of your own health, visit BIRI.org. You'll find valuable information, free tools and ways to connect directly with our wellness community. That's BIRI.org. If you enjoyed today's episode, be sure to subscribe and share the show with someone who's ready to take their next step toward better health.